With the rate of new infections at its lowest since the pandemic began, New York Governor Andrew Cuomo certainly has reason to boast.
We've been doing a great job keeping control of this virus. Congratulations to the people of New York.
Once the U.S. epicenter of COVID-19, the state is reopening in phases, including in New York City, which saw the longest and most severe lockdown in the country.
Moving fast to have a shutdown, despite the economic cost, I think, saved New York from an even worse situation.
Subject to new safety protocols, gyms across the state can now reopen, museums can take in visitors, retail therapy is back, and restaurants are permitted seating al fresco. New York's handling of the pandemic has been hailed as a COVID-19 success story, from putting the state under lockdown and collaborating with neighboring states to slow the spread of the virus, to rolling out advisories on hand washing, social distancing, and later, mask wearing. As cases spiked in the spring, Governor Cuomo suspended elective surgeries, wrestled to procure gloves, masks, and other protective gear for healthcare workers, and advocated widespread testing. His steering of New York through the crisis won him praise, especially in contrast to leadership elsewhere.
I thought he was a counterweight to poor leadership from the federal government. Trump and the federal scientists, I think, were sending inconsistent information.
So it is a success story, but at the same time, we haven't that much competition within the United States. My family is from Houston, and it's really difficult to find tests there. You know, people are on hold for hours. You have to pay over $100 to get a test. People aren't getting tested.
But success came at a price. Statewide, the total death toll is around 33,000. New York's big blind spot, and by extension Cuomo's, was nursing homes, where COVID-19 outbreaks spiraled out of control. State unemployment is nearly 16%, the second highest in the country. New York City alone estimates revenue losses tied to the pandemic at $9 billion. And going back into business with the virus still at large and testing in short supply is a balancing act.
I think we need rapid results tests, whereas right now we have 3 to 5 days.
I think this time around it could be tough. Remember, it could be exacerbated with the flu. Maybe we might even get measles back because a lot of kids are missing their shots, so we could get more challenges, but we have more knowledge. So I'm a little more optimistic that it won't be as crazy in the winter, in the spring.
Professor Kaplan's advice: take baby steps to reopening, especially with no immediate vaccine or one-size-fits-all remedy in sight. Li Ling Tan, CGTN, New York.